It's 12:02, so we can kick off our session. So, hey, dear Nordic friends and friends of Nordics, welcome to our Nordic Health Solutions for COVID-19 Batch 1 virtual event. My name is Sami Jääskeläinen from Nordic Innovation House, and I'll be your host today. So it is my great pleasure to warmly welcome you all. Before we go to the actual event, I want to mention a few things about the Nordic Health Program, what Nordic Innovation House is organizing this year with its core partners, Business Sweden, Innovation Norway, Finnish Embassy, and Promote Iceland. And as a part of this team, we will organize a virtual Nordic Health Program in Singapore in September. And currently we are identifying problem statement owners from Singaporean stakeholders and also mapping out the Nordic med and health tech companies, which then have something or some good solutions to offer against these identified problem statements. And I know that we have discussed with some of our audiences already today from the Singapore stakeholder side, but if your organization, team or department have any additional problem statements and you are interested into collaboration with the Nordic med and health tech companies, please let us know, and then we can explore how we can include you to our program. Great. But today, so really the purpose of this event today is to showcase a really interesting group of hand-picked Nordic tech companies that have relevant solutions against the problem statements that we have collected and identified from multiple public healthcare stakeholders and institutions here in Singapore. Also, all the companies have tested digital and non-digital solutions for COVID-19. They have interest towards Singapore markets and also good delivery capabilities. And we have grouped the companies, and they're also presenting to us today in a specific order. And we will start the companies then showcasing solutions around telemedicine and remote communication, followed by PPE, design and supply chain, and decontamination. Then we will have companies showing solutions related to staff resilience, psychological well-being, staff training, retraining, and so on. And then lastly, we have companies around rapid diagnosis. And we have one company update. Unfortunately, Neuvola from Finland isn't able to join us today. So we have a busy platform from Finland instead, and it will be represented by Nino da Silva. And before we start, a couple of house rules quickly. So please note that all the participants are muted. So remember to unmute yourself when presenting and asking questions during the Q&A session. And if you have any direct questions for host, please use the chat function and we will take the questions from there. Each company will have 5 minutes to present, and then we have 5 minutes for the Q&A. And please also know that that event will be recorded, and all the presentations and presentation materials included in this video will be available and sent for all the participants after the event. But now, and without any further ado, I will hand over to our first company, Imatis, and we will have Dan Credazzi present. Please, Dan, share your screen.
Thank you, Sami. Everyone can hear me all right? Yes? Great. Imatis is a 29-year-old Norwegian software company. We've created a suite of lightweight IT tools which our hospital clients use as their platform for rapid generative workflow innovation. This is our headquarters in Porsgrunn, Norway, in the converted porcelain factory behind me, which is now our IT hub. And we have offices in Oslo, Torino, Italy, Sydney, and Ho Chi Minh City. I'll share my screen now to begin a presentation. It should work. And it is working. Sami?
Yep.
Yeah, okay. We're present in 80 hospitals and clinics around the world and in 16 hospitals in Australia. Many of our hospitals in Norway are in Norway, and these existing clients use our Imatis installation to create their own pandemic tracking apps and widgets that work for their particular hospital workflow and staff. All of these self-developed apps were up and running within 1 week during the peak of the pandemic. This is because we teach our clients, super users, to reconfigure our software portals on the fly. But the COVID-19 situation was also very challenging for the local healthcare services in cities in Norway that were not our clients. So the government challenged Imatis to come up with this pandemic toolbox, which we now offer to Singapore. During the peak of the pandemic, 3 Oslo health districts amalgamated into one to consolidate the clinical response and resources. And Imatis was challenged to deploy this pandemic toolbox, and in 10 days later, we had it up and running for the Oslo COVID fever clinic. This is what we are offering today to show you, and it has been reconfigured to accommodate what we learned about the Singapore pathway, where if you can see my arrow, where the doctors are mobilized and out in the field. This is similar to the pathway in Norway, which involved the drive-through clinics. So we can rapidly reconfigure this Norwegian configuration for use in Singapore, for example. What I was going to do is click through these flow diagram and show some example screenshots from our app. We only have 5 minutes, but I'm happy to go into more detail in the Q&A session. So you can see here, this is how the cohort of patients on the left side is identified, and then engagement with the patients commences with SMS, with instructions, websites to visit. An important aspect of our solution for patients is that they did not have to download any separate apps. These are all web links, so it made things such as the self-assessment much easier. This is an example of the self-assessment questionnaire that was sent out to patients in the cohorts, and it can be quickly remodified in order, questions, anything to change these parameters. The important thing to note was that our solution was created, of course, in Norwegian language, but Innovation Norway gave us a rapid grant to help fund our translating this whole solution into English. So that has been accomplished. It's also worth noting that our solution is available in Bahasa and Zhongwen in the Royal Adelaide Hospital outpatient clinic right now, so we can cover different languages. This, when the questionnaires are received back by the central command, the nurse station, wherever, this is an example of the scoring of the cohort, and we can prioritize and then activate follow-on treatments such as a video clinic or a clinic appointment. And I've gone back too far, sorry. So the second pathway, when a video appointment is required, what we've done here is used our inbuilt web RTC function in our portals to create a direct link between the patients and the clinicians, who are sometimes both isolated, and that was the case in Oslo when this was in use, where we had clinical people isolated, patients isolated, but they were able to talk, and the clinician had the case information, the recent scores from the questionnaire up on their screen, on their Imatis screen.
Okay, done. And that was the 5-minute ring, what you just heard. So thank you for sharing and showcasing this. And now we're going to hand over for the audience, so you can ask questions. And we have 5 minutes for the Q&A. Please remember to unmute yourself.
Well, it's not easy being first, but we have made this available and can follow up anytime.
Okay, Dan, maybe if you wanna, because I broke your presentation a little bit, so let's use that, utilize the 5 minutes what we have left in order to keep the schedule so you can share those additional things. And audience, again, if you have a questions, please feel free to unmute yourself and ask.
Thanks again, Sammy. Just to finish up, when a field visit is required, either in a car or at the patient's home, we've accommodated this in the recent configuration, and everything is captured in these summary boards so that you can monitor the condition over time, in real time, of the patient cohort. So this is, like I said, available in English, Bahasa, and Zhongguohua. Thank you for your time and attention. That's it. We kept it short, Sammy.
Okay.
Maybe I can also add, this is Paul Kasman from Innovation Norway. If anyone has any questions during the presentation, please feel free to put them in the chat, and then we can raise them towards the end.
All right. Thank you, Paul. All right. Let's move on then to the next company. So then we have AppSens, also coming from Norway, and we have a Ytterdahl. Please, please share your screen and start your presentation.
Hi, Tord here. I will share my screen. Are you okay?
Yep.
Okay, my name is Tord Ytterdahl. I'm the CEO of the Norwegian company AppSens. So this is about extended cardiac monitoring. AppSens, it's a medtech company which was established in 2017. We were ISO 13485 certified this year. We are a team with sensor technology background and cardiology expertise. We're partnered with Sørlandet Hospital in Norway for clinical trials and studies. And we are about to finish the development of an innovative and disruptive heart monitoring technology named ECG 24/7. We expect to be on the market from June this year, and we expect to see approval from the DNVGL end of this month. Out of the team, I would like to mention that head of our advisory board is Dan Attar. He's the former leader of the European Society of Cardiology. So this is about AF, atrial fibrillation. It's a major problem. It's common, but it's underdiagnosed heart rhythm disorder. Affects roughly 50,000 people in Singapore, and majority of them are unaware because there are no symptoms. Numbers may double by 2050 due to the aging population. So the problem is just getting bigger. 30% of all strokes are due to AF. And in Singapore, you have 26 strokes every day. So if we can help by reducing that numbers, it would be great. In Singapore, you have about 600,000 people above 65 years of age. And the European Society of Cardiology, they recommend everybody above 65 years of age to screen for AF and other severe arrhythmias. And when you look at the global potential, it's huge. Singapore, China, Japan, Western Europe, and US counts for more than 190 million people above 65 years of age. So the solution, as you can see on the picture on the left, is the traditional Holter used in the hospitals most frequently today. This was stopped during the COVID-19 because of the risk of infection. So our system, it's extended cardiac monitoring. It's affordable, it's workflow efficient, it's easy access to the data, it's fewer false alarms. We have a patented noise shielding technology. It's ideal for professional healthcare market as well as consumers, and it's ideal for screening of a larger population. So you put on a sensor to the chest, you connect to your smartphone, and the data, the ECG recordings, are automatically uploaded to a cloud, and it's easily accessible immediately for the cardiologist, the hospital, or the doctor for a confirmation of the diagnosis. So it's out of hospital diagnostics. It's a telemedicine, it enabling remote communications. The cardiologist, the hospital can report directly in the web portal, which makes the report available for the patient, the user, in the app, the smartphone app. And it's rapid diagnosis. You get the results immediately. You are notified on the mobile phone, and all the data and all the arrhythmias recorded are uploaded immediately to the web portal. So the doctor, the cardiologist, can confirm the diagnosis. So please join us in detecting AF. We can make a difference for many individuals that are at risk of stroke. And in Singapore, we invite cooperative partners, hospital partners for clinical trials and studies in Singapore and Asia, distribution partners for the Singapore professional health market, and business partners that are willing to build and develop our company and offering globally. And I think we have something to contribute to a pandemic situation like COVID-19 with our product and service. Thank you very much.
All right, thank you, Thor. And now we're going to hand over the microphone to the audience. So please, do we have any questions from the audience? We have a couple of questions here on the group chat, but I'll give the stage first for the audience. Okay, and while waiting there, I'll pick this question from the chat. So there was, are the patients able to see the ECG, was the question.
Yes, the ECG is visible live on the application, the app, the smartphone app. So you can monitor your ECG live at any time.
Good. Do we have any other questions from the audience? Okay. Well, Thor, I have one question for you. So regarding the Singapore, so what are your current plans, ongoing projects or partnerships here in Singapore?
Yes, we are entering the Norwegian market first in June. Then we are, of course, looking into other geographic markets, and we believe Asia, with the high focus on technology and new kind of medical devices, that makes this a very interesting market, and we see Singapore as a great gateway to the Singaporean market. So we hope that the hospitals and distribution partners will take part and test and validate our product and service. So we hope that we will be able to tempt maybe the hospital to start with some small scale testing. Maybe we can find a study together. That's what we're doing with the Norwegian hospitals. And besides Asia, we are of course looking at other European markets in parallel, like Germany and UK, and of course US. But as I said, the Asian market is very relevant for us. So we hope that we will find someone who's interested to start testing, studying, or seeing if we can reach out to the Singaporean market and the professional health care market.
Okay, very good. Then we have one question from the audience. So this is, how long can the device be used?
It's really how long the patch will be attached to the body, which really define how long. We recommend that you wear it at least for 3 days. You can use it when you do every normal activity, showering, training, exercising, sleeping. So we've had people wearing it for more than 6 weeks. But we're happy if someone can wear it 3 days or maybe a week. Then you get a very good time period for detecting any possible arrhythmias and atrial fibrillation, for instance.
Okay, good. Any other questions? All right. And like I mentioned earlier, so all the presentation decks from each companies, including then their contact details, and also this video will be then shared with all the participants after the event. So if some urgent questions will come to your mind later on, you will have the contact details for all the companies representatives. Okay. Good. Thank you so much, George. Very good presentation. Next, I want to invite Body Healthcare and Markus Lind. Please share your screen.
Hi, good afternoon. And thanks for having me here to present our company and our solution to you. As anyone of you know, remote monitoring of COVID-19 patients or self-quarantine monitoring requires lots of people to call the patients and ask symptoms, at least in daily basis. And with the request of several hospitals, we have done a remote monitoring care process to follow the patients when they are at home to our body care platform. And how the remote care monitoring works. When the patient is set to self-isolation to home, he or she will download our application where they have COVID-19 care process. And in the care process, they have daily symptom checks, what they are feeling about the COVID-19 symptoms like fever, sore throat, etc. And from the hospital side, the dashboard tracks what the patient symptoms are, and if there's some symptoms exceeding set thresholds, it will alert healthcare professionals. All data is collected and can be used for further analysis or for study purposes. So the platform consists mobile app for patients, where they have accurate information and instructions about COVID-19, daily symptom checks, what the patients are feeling about fever, coughing, sore throat, etc. And in the app, they have a secure communication channel to hospital, which they can use for asking more questions, including photos, videos, etc. Dashboard for healthcare professionals follows the patient active symptoms, and if there are symptoms that exceeds the set thresholds, it will alert healthcare professionals. They can communicate with the patients through the platform, and also they can set patients to the risk group if needed. All data is collected and all symptoms are collected for reporting and analysis. The COVID-19 care pathway has been built on the body care mobile care coordination platform. With this modular platform, and onto it, we can create any kind of care processes from operative side to psychiatry, internal medicine, and chronic care. The platform is already in use in 70 different medical specialties in over 150 care pathways in 5 countries. We are a Finnish-based company, and most of our customers, of course, is here in Finland. And then we have customers in Germany, US, Brazil, and also we are conducting 3 different clinical trials in Singapore with 4 different hospitals. Platform is CE marked, GDPR and HIPAA audited, and we are supporting 12 languages at the moment. The COVID-19 care pathway is in use in 2 different hospital districts here in Finland and in Germany. And in Germany, we have integrated our data to Robert Koch Institute, which is the highest virology institute in Germany. Thank you.
All right, Markus, thank you so much for the presentation. And let's wait and see if we have any questions from the audience. Okay, and then we have one question here in the chat. The audience can also then unmute yourself and ask the questions directly. What 3 languages are available in the app?
12. So
12.
all the major languages in Europe, like English, German, France, Spain, Italy, Portuguese, Dutch, Polish, Swedish, and Finnish. And also we have Indonesia in our platform, and Brazilian and Portuguese. And translations can be done in quite fast basis if needed.
Okay, and have you already planned to have simplified Chinese in the platform?
Yes, there has been a request to translate our platform to Chinese, but we haven't started the process yet, but it's quite fast forward to do, and we have most of our development persons are Chinese, located in Helsinki, so we have in-house support for signing.
Okay, very good.
There was one question about the local servers. Yes, it can be, the platform can be run in the local servers, can run in a cloud in Singapore, or can be a mixed solution where the data is located in a Singaporean national servers and software is running in a cloud service in Singapore. Either way.
Okay, very good.
This is Terence from Enterprise Singapore. First of all, a big hello to my friends in Nordic Innovation House. Markus, thanks for the presentation. I noticed that some of the areas of your software deal with psychiatry and pain management, right? Just like to ask whether the software you provide does any analysis of emotions of the patient.
Yes, we have several features tracking the emotions, visual measures in the app for the patient, and all data, of course, is analyzed in the dashboard and shown to doctors and nurses as they wish. But we have a mental visual test, or how I say, it's several different kind of measurement systems for the patient. It's not only questions. There are ruler, there are phases. You are choosing your feelings, etc., etc.
I see. If there were in-depth emotion analysis player in Singapore that can track up to 64,000 different emotions. Do you think it will be useful for you?
Yes, it will be useful as what we have noticed now that any remote care company has noticed that the highest demand at the moment is psychiatric, and we have lots of requests from different psychiatric departments to start projects with us because the COVID-19 situation has worsened the situation of psychiatric patients.
Yeah.
And those are the last ones who will get treatment, because then first you have to treat the patient with the cancer, with the heart problems, etc. And now the issue with psychiatry is huge.
Okay, maybe we can take it offline. I can probably connect you with the relevant person.
Yes, let's do so. Thank you very much.
Thank you.
Great, thank you so much, Terence. And like I said, if you need any contact details additional on top of what we will share after the event, please contact us, and we will make sure that you have all the needed details. Very good. Okay, now it's time to move forward, and the next company will be BC Platforms, and we have Nino da Silva, who is EVP in EMEA-APAC. He will be presenting BC Platform Solutions. Nino, over to you. Please share your screen.
Hello, can you all hear me and see me?
Yes. Hello.
Excellent. Thank you for the invitation. It's an honor to be here. I'm going to talk very little about products and a lot about a high-level vision that we are working on several locations, amongst others in the UK NHS and in Finland, our home turf and home country. With that said, I'm located here in Singapore. I'm heading up our Asia Pacific and actually global business development. And at this point in Singapore, we have established our first office with R&D outside of Finland. And it's a great pleasure to be here, I have to say. Singapore has been very successful in the COVID situation, both with the preventive and the active models in order to flatten the curve. Finland has also actually been quite successful in this. But what we wanted to look at is a bit of thinking around how you can exit this and how you can prevent these lockdowns from happening again. And some of the reasons to do that is simply that if you look at the financial cost on the whole society from these events that are happening now, they are extraordinary, to say the least. These are projections of the time to recuperate for different areas in the world from this substantial lockdowns and economical impacts. If you go further, if you look directly for example, on Finland as such, you would see that the GDP actually decreases with about 1.8% per lockdown month. And the impact in monetary terms for Finland is approximately 4.2 billion euros per month. And that is the cost for being quite effective. And I think that Singapore can probably show quite similar figures to this, on proportion, of course. With that said, there is a way we believe there's a way, and there's science to back that up, that there's ways to create predictive models for COVID-19 and similar corona family viruses, as well as others. And there's also a way to create a research data platform to do this. So what we have been working with is a model to identify high-risk patients for severe disease based on genomics and in combination with phenotypic data. And what you need to do that in the predictive model is to create enough of a database of such cases to have as a platform. In Singapore, this will be a challenge because the number of people that has actually contracted COVID is quite few. On the other hand, there is a migrant worker community where the numbers are sufficient, and that combined and extrapolated on the local population could still be quite useful and do basically the same as Finland is planning to do. in order to create a research data platform, you need a substantially higher number of the population because that's more about preventive work. And we have been developing models to do this together with the Finnish health authorities, HUS and VEIK, as well as we have been doing this with Southampton, UK and NHS. And it looks something like this, very simply. You look at the population and you basically target the standard population, which is the working population between say 22, 23 up to 65, 70. High risk patients are always the older, and you would say that the lower risk children, for example, and up to the working age can, meaning that they are all offspring of the parents, and if the parents are genotyped, you don't actually need to genotype the children unless they have severe diseases and are in risk group because of that. And with that, you could move on to limited social distancing for the group that you can identify the disease risk in. High social distancing, of course, for the older and risk groups. But this would enable a society to not lock down completely, but to have targeted lockdown and predict which parts of the population needs to be protected so that business can continue and the country doesn't have to stall its monetary and financial works. As a case, a real-time case, I can show you this one. This is at University of Southampton, one of the NHS, where we deployed our system to do the COVID work for both preventive and reactive work in 2 weeks, about 8 weeks ago, and they are running full since then, producing amongst other, I think the real value here is to look at what they've been doing. They are doing 2 things. Real-time insights for clinical capacity and resource optimization. This is what they call search prediction algorithms. And the second part is rapid patient stratification by risk and disease manifestation. I'm happy to share, there's a webinar with the professor talking. I'm happy to share this if you're interested in listening to how they've been working, what the results are. Yeah,
Okay.
that is probably time out there, I think.
Yes, that was the timer. Thank you so much, Nino, for saying.
Thank you.
And let's hand over the microphone to the audience. Do we have any questions regarding the BC platforms? Okay, and we have one question here. What do you sell? What is your solution? What do you sell?
So we are a software development company, but I normally like to say that we are a knowledge company with a software rather than vice versa. So we have a software platform that's been deployed in 25 countries and over 130 sites. Everything from UK Biobank data handling to our recent awarded 2020 Healthcare Innovation Award from Microsoft for the Kaiser Permanente implementation of a Kaiser Permanente-wide research and analytics platform for their biobanks, encompassing 400,000 subjects. So our expert area is really in making data available.
Very good. And you mentioned already that you have the presence here currently in Singapore. Anything you would like to share regarding additional Singapore or Southeast Asia plans?
So we have established installations in Indonesia, in Thailand, Indonesia, Thailand, and also pilots running now in Singapore. We are very happy to have worked already in Singapore. We established our office here in August last year. And we also have a number of installations in Australia and New Zealand since over 15 years, actually. So we're quite well established historically.
Thank you.
Thank you.
Any other questions from the audience? We still have a few minutes. Nino, did you have any additional slides if you want to use the time what we have available to cover some additional topics?
I'm perfectly fine. I would just like to add the end of this is that if you want to look at COVID not for reactive measures, but for predictive measures, there's a need for consolidating data resources in each of the countries. And there's a need for countries to combine these resources because it is clear that there are genetics markers to this. It is clear that we can do something to change the behavioral pattern on a countrywide scale. Not saying that we haven't been extremely successful in Singapore. I think we should be proud about what's been done here. But there's also a possibility to improve by using the science and the data that is being collected now around the world.
Very good. Great wrap up. Thank you, Nino.
Thank you.
And next, I'm going to invite Ville Mujunen presenting Ninchat. Ville, please share your screen.
Hey, hello, everybody.
Hello, hello.
Here we go. Can you see my screen?
Yes.
Right, so good morning and afternoon, everybody. My name is Ville Mujunen and I'm coming from a secure messaging company called Ninchat. So what we make, we provide messaging flows in your brand look and feel, customized to different use cases. And so far, oh boy, how COVID has changed our situation. We've been we've been a rise of the telemedicine has been happening during the last weeks. We've been onboarding thousands of doctors to enable remote messaging with the patients. So at the moment, we've got about something like 5,000 doctors using Ninchat for video messaging and chat messaging with their patients, and about the volumes, there's something like 500,000 consultations done so far. But messaging, I think I'd like to raise one key point. It's not just about that you kind of have a video or chat messaging. It's more about kind of when you digitize the messaging flow that you typically done on by the desk. So actually you start to get data, and this data is a super powerful way to transform your organizations. You actually start to kind of learn what works, what doesn't work, how can you improve, and it's kind of one of the most powerful tools that you can have to have a change, which is like a digitally native change for the operation in your organization. So where are we? So we're a Finnish company. Most of our customers are in the healthcare field, working with the largest Finnish healthcare service providers for both external patient messaging, so authenticated patients coming in for getting prescriptions renewed or showing symptoms. Also internal messaging, so nurse asking something from a doctor asking something from a specialist doctor. Then there's internal team messaging, and then external peer support groups and so on. So here's our team. And about the company, so we're operating from our cash flow, so profitable growing from there. So the difference by being bootstrapped means that we really need to focus on customer needs. So we are only here to kind of help you succeed. So that's the whole message, and that's why the product is also in your brand and look and feel. I show you a couple of kind of variations of the Ninchat messaging product. So here's a notifier app, so you can share a specialist resource. So like one doctor can serve 5 hospitals. Let's say we have a case where a neurologist is being shared among multiple hospitals. So it can also be a group. So any neurologist free on the country who can pick up the request and serve through video chat the case. Quite interesting. Then there's standard chat and video messaging with screen sharing and digital stethoscope support and so on. And then we've got bots which save time and help to automate processes. Then we've got mobile SDK. So if you have existing mobile app, already. So let's add video and chat messaging there into your own app. And then here we have group chats. How the system works. So basically, we're kind of more interested. We're not that it's kind of like always kind of what's your target. So what kind of information does the nurse need to do to perform this task? So let's collect that information before from the patient if it's possible, or the professional who's asking for internal consultation. Let's get the background data there, so there's no waiting. There's all the data available for the next steps or automation and so on. So that's how we build the flows. All kind of standard features are there, works on mobile and web. The product is so we've got about 100 customers, mainly in Europe, and now we are also looking for Asia specifically. The product we know it's scalable. And the data security requirements we can customize per customer. So the data is at the moment in EU and GDPR okay, but we can also store the discussion data on your, let's say, hospital premises. The delivery is pretty fast. We can deliver in about 2 weeks, and it's a SaaS licensing model. What we are looking for, so new partners, health service providers and hospitals, and also local distribution partners. I think that's my 5 minutes. Thank you.
Yes, very good. Thank you, Ville. All right. Okay. Then we have a couple of questions here on the chat. So, Ville, could you be able to share more details about the automation feature?
Which feature?
Automation.
Okay. So what we have here. For example, in the Lightbot, so we can have a kind of the bot collect data before, and then all of this data that has been collected is part of the transcript, which can also be added by the professional. So we can have a messaging support panel in the chat window, so where you can add notes and trigger actions. So then afterwards, let's say kind of patient consultation, you can trigger for example prescriptions, or you can trigger some other actions. Let's get the person to the lab and so on. So we use both webhooks, and then it's possible to trigger the automations to reduce duplicate work from through fetching the transcripts from the API, and then there catching the events that you want to do. So either immediately through webhooks, or then manually with your app fetching the data from the API.
Okay, good. Thank you, Ville. Then we have another question here regarding the language versions.
Language versions we support at the end the embeddable version, which is kind of in your mobile app or in your website for the patients, or in your intranet for your professionals. That can be in any language. It's really easy. We at the moment we support Thai, Arabic, European languages, all kind of character sets. So no problem. The admin kind of the professional interface is at the moment in English and German, but it can also be if your professionals do not speak English, then we can also customize that if there's a case. But that's a little bit. There's so much more functions, so it's a bit more. It takes maybe a couple of days more to translate into your own special custom language.
Okay, good. And then I have one question, Ville, for you regarding the Singapore plans.
So Singapore, at the moment, we see Asia. There's a lot of interest at the moment. We are seeing Singapore as a first of all as a hub for the whole Asian market. So there's a lot of possibility. It's kind of also the first market, it's kind of a stepping market where we could kind of operate from there. So it's So especially looking at the distribution partners. So that's I see Singapore is very interesting, and by being an advanced market. So it's also and with the high mobile phone device penetration, it's also good for telemedicine. So for the clients part as well.
Okay, good. Thank you. Do we have any other questions from the audience?
If you are interested, we can make you a demo at no cost in your brand and look and feel. So just ping me after this, so we'll get you guys going.
All right.
In a matter of a week.
Okay, great. Thank you so much, Ville, for sharing the Ninchat solutions. And we're going to move forward now. Next company to present is Care to Translate. Do we have Linus on the line?
Yes.
Hey, good morning, Linus.
Morning.
Good morning. Please share your screen, and then the stage is yours.
Can you see the presentation?
Yes.
Great. Okay, so my name is Linus. I am the CEO and founder of Care to Translate, a digital interpreter. So a 1-year-old girl died because of language barriers at Sahlgrenska Hospital in Gothenburg in Sweden. The staff did not understand that she had asthma because her parents did not speak Swedish, and even though the interpreter was present. During her surgery, she stopped breathing and died. Of course, not only because of language barriers, but this example shows how important safe communication is in a healthcare context. So in order to make language barriers equal and tear down language barriers, we have developed Care to Translate, which is a medical translator. We have an obligation to provide people with equal care. Still, good solutions in healthcare are lacking for breaking language barriers. And this has serious consequences such as misdiagnosis, malpractice, complications, prolonged hospitalizations, and increased readmissions. And the most common solution for reducing language barriers in healthcare is to book an interpreter during planned visits. But accessibility is limited and inflexible. And on top of that, medical certified interpreters are scarce. And to give you a number, in Sweden, we have no healthcare interpreters in Dari, spoken by in Afghanistan, Somali, Bulgarian. And the chance that you, as a foreign-born person, get a certified healthcare interpreter when you have a doctor's visit is minimal. And this affects, of course, the quality. And in many parts of the chains, there are no interpreters at all. In the ambulance, in the reception, in the emergency, in the triage. And we estimate that only 10% of all healthcare staff have access to interpreters today, which means that about 90% of the staff are without. But what are the alternatives to interpreters? Many people probably think of machine translation. Those solutions work well if you need to translate an email. But within healthcare, there's no room for error or error margin, and we cannot have 99% correct. We must not misunderstand the question. Does your daughter have asthma? It must be 100% correct. And here's an example of how machine translation works today. Our goal is to replace the interpreter in healthcare. And today, Care to Translate offers translation in 30 different languages, which is much more than the competition and which makes us, in addition to the fastest, also the most comprehensive medical translator in the world. Patients and healthcare professionals can communicate in text and sound with translations that are verified medically, culturally, and contextually. And this is not supported by machine translation. The app is available for smart devices to download and is available 24/7, no matter where you work in healthcare or what role you have. It has an easy onboarding, selects the patient's languages. After that, you navigate between different topics or specialities, or search directly for what you want to say. You can then press the phrase and then it translates both sound and text into patient languages. And we offer this application as a SaaS solution where you can use basic range completely free of charge, but you can also unlock more functionality through monthly or yearly subscriptions. And we target both end users directly and the healthcare staff, but we also target entire healthcare organizations such as clinics, hospitals, municipalities, regions. And we have experienced a rapid growth with about 70% organic users since the company was established 2 years ago, and now have over 100,000 users in over 170 countries. And we are proud to say that we have facilitated over 2 million translations today. And since March, we have included a Corona triage, which is used a lot in different emergency clinics now, where you can triage your patients, their needs without having an interpreter in place or on the phone. And coming quite far in a short amount of time, we have received appreciation by others, which makes us really happy. Our team is very professional. We have a vast experience in entrepreneurship, technology, healthcare, and languages. And I have no doubt that our strong team will make us reach the goal of replacing interpreters in healthcare with a voice-controlled digital translation soon. Thank you very much for the presentation.
Very good. Thank you so much, Linus. And let's see if we have any questions then from the audience. So we have one question regarding a business model. So how much is a monthly and yearly subscription?
So currently, I mean, of course, we are selling mostly B2B in Sweden, but we have we take a yearly subscription about 500 euros for one unit. So that means that if you're working like with one iPad, you have 500 euros for that unit per year. And then there's a stepping where you get cheaper. I mean, cheaper prices the more units you buy. But if you have more questions about that, then I'll definitely show you that and can demo the product more as well.
Okay, good. Thank you. I have a question regarding then the language versions, especially simplified Chinese, and how about the other Southeast Asian languages? Do you have any of these currently implemented?
We're currently looking into it, actually. So we have not been so active in Southeast Asia so far. We have added the Chinese Mandarin in the app, and we are currently adding Thai. But our prioritization is to add most of the languages in Southeast Asia. We're looking into Malay for currently, and Vietnamese, as well as Bengali. But for us, like if we see that there's a need, we can add a language. It takes approximately 1 month, and then we have it in the application to cross-translate without any problem.
Okay, good. Then we have a couple of additional questions here. Have you implemented any? Have you implemented inpatient care solutions?
The application is used in the physical right now, in the physical meeting between a healthcare professional and patients. But it can so when a patient comes, you can use the application to translate what you want to say to the patient and ask those questions you want to say. So you open up application in the iPad or iPhone or Android or whatever, and then you press what you want to say. Let's say you have some types of questions about Corona. Wait, I can show you here maybe. Like this. You also you just answer yes or no, and then you click like, do you have a runny nose? Do you have a cough? Do you have a sore throat? And then it translates to the patient's language when they can just answer yes or no, and that can make the triage much easier, for example. It can also be used in the hospital care, of course, when they are submitted and they're there for a couple of days, and then you can use it for lots of other reasons. We have thousands of phrases in the application right now.
Good. And I have again one additional question is regarding the new plans regarding Singapore or Southeast Asian markets.
We are very interested in Singapore of several reasons. We know that there's a lot of medical tourism, and maybe not currently, but we know that they're in the area. But we also know that there's a lot of migrant workers in Singapore that's probably affected now because of the coronavirus, and they speak many different languages, and we think that we can help out in that sense. So if we have an interest from Singapore, we are very much we're very happy to help out there.
Good, and hopefully this session today will spark some additional conversations. We have a question here on the chat. You mentioned that the voice control function is in the pipeline. What is your estimate that this function will be implemented and available?
It's a quite long answer. I take a short answer for that. It depends on the language. Some languages have quite good voice recognition. Other language has worse. So it depends on where you are in the world. Most like Chinese Mandarin is quite good voice recognition, but if you work with, let's say, Tigrinya from East Africa, that voice recognition is not there yet. The technique is not available in the world. So we implement the best technology there is when there is that technology, but it's not there yet.
Okay, good. And then we have additional question. What about translating what patients say? For example, during the history taking, could patients' response be translated?
Sadly, not yet. It's not currently that. It's just fixed phrases. However, we have, of course, a patient side as well, where patients can describe their symptoms much more deeply as well. But it's still a multiple choice way because of the way we use it so far, because we have to do it that way because it's in a safe verified phrases from the beginning. But I can show a demo and go deeper into that if somebody is interested in how it works.
Okay, very good. Thank you so much, Linus, showing can translate solutions. And like I said earlier, and also for the latecomers, all the presentations and contact details of the company representatives will be available and shared with the participants after the event. Then our next company is coming from Iceland. I want to say a special kudos for Icelandic companies because it's very early. They are 8 hours behind. But without any further ado, we have Sidekick Health and Tryggvi. Please share your screen.
Thank you, Sami. So I hope you can see my screen here.
Yes.
Great. It's a pleasure to be here with you today. Thank you for your time. My name is Tryggvi. I'm a co-founder and CEO of Sidekick Health. First, a little bit of background on the company. Sidekick is a CE-marked digital care platform. We work with global customers, including Pfizer and Bayer, to expand therapy across multiple therapeutic areas and diseases. Working in multiple countries currently, and we've been shown to improve a wide range of health outcomes such as diabetes mortality risk, cardiovascular fitness, weight, blood glucose, anxiety, medication adherence, and many other factors. And I'm going to tell you about the use here in Iceland in a nationwide program for remote monitoring and support of patients with COVID-19. First, briefly for context on the platform, here are some examples on our clinical outcomes. This is a randomized trial showing Sidekick having a significant improvement on weight control with obese patients. Here's another trial showing significant improvements in blood glucose control with type 2 diabetic patients with significant reductions in HbA1c. We've shown improvements across peripheral artery disease with elderly patients. And in all, over the past 6 years of operations, we've shown impacts on several types of mental health outcomes, health behaviors, and clinical outcomes, as I mentioned, ranging from blood glucose to medication adherence. So this was the core platform that we had. We've been developing over 6 years. And when COVID hit, we saw that we had something that we felt could help remotely monitor and support patients with COVID-19. The solution is built as a platform, so we're already live in over 10 therapeutic areas, and we can quite rapidly add new therapeutic areas to the solution. So that was the background on the platform. What we did here in Iceland is anyone with COVID-19 being treated or monitored at home in home isolation received a text message to download the Sidekick COVID-19 app. Once they tapped the text message, they entered into the program, received prompts to fill out symptom checks once or twice a day. Through the smartphone, they also received video support and a lot of other things that I'll show you in a minute. Through the symptom checks, the system then assesses people's risk classification, ranging from green to blue. This classification is displayed on a care portal for the care team, and then the system takes action based on that classification, ranging from sending automated texts to calls for action. And this remote care program here in Iceland, together with high levels of testing, has been thanked for positive outcomes such as low ICU admission rates and low ICU mortality, because we're able to identify and fix problems earlier, like addressing dehydration before patients go into renal failure. These are some of the main features on the platform. Targeted patient information. So we send out every day, we send out videos to patients talking about what are the symptoms to look out for, how to manage the stress of the situation. We have a physiotherapist teaching breathing exercises, and so a host of videos to support the patient. We prompt them for symptom checks once or twice a day. The particular questions can be adapted to new patient populations, but this is a panel of questions that we decided on with a panel of 9 infectious disease experts who are trained both in the US and Europe. The algorithm that classifies the risk for the patient was developed with a team of infectious disease experts and intensive care experts trained in top universities, both in Europe and the US, as well as data scientists from Google and elsewhere. The clinical algorithm basically takes the different symptoms, like here fatigue, and assigns a risk score ranging from, in this case, 1 to 25. And the clinician can see on the dashboard how symptoms like fatigue are evolving day by day. And the seriousness is shown by numbers and colors. And then we aggregate all of the different symptoms each day into an aggregate risk score, which is then classified into 4 risk categories. The 4 risk categories are made to mirror the clinical evolution of the disease, ranging from constitutional symptoms into the pulmonary phase, which is 2A, which is not hypoxic, and 2B, which is hypoxic, and then into stage 3, which is the hyperinflammation phase. Then there's the system opens up a communication channel between the patient and the care team, medication management if people are taking medications, and mental health for stress relief. All of this so that one care team professional can remotely support a large number of patients. And finally, just mentioning that the same system is then used also throughout COVID to support other vulnerable populations, like people with chronic heart failure and other conditions. Thank you.
All right, very good. Thank you, Tryggvi. And again, let's hand over the microphone to our audience and see if we have any questions. While waiting that, I have a question regarding then your plans regarding the Singapore, Southeast Asia markets, and then the second question regarding the localization. Is it possible? What would be the timeline to do that, and so on?
Yes, we have localized the Sidekick platform has been and is been localized to 10 different countries. So we have a very robust process for doing that. We just recently signed an agreement with one of the largest health insurers in Japan. So that's our first step into this market, but we have not operated in Singapore before. But the platform is made so that we can quite rapidly localize all of the content, the videos, the messages. We integrate with clinical teams, making sure that we adapt to the clinical protocols, to the workflow, and we can adapt the questions that we ask, and we can also adapt the weighing on the clinical algorithm.
Very good, thank you. Good. And let's give a bit time if you have any additional questions. But Tryggvi, did you want to still, because I need to interrupt your presentation, so was there any additional things what you want to highlight? We still have a few minutes to.
I could, at least if there are no questions for now, I could show you a slightly more detailed overview of how the system works, if that's okay. Yeah. So here's just a walkthrough, a more detailed walkthrough through the sequence. So basically here in Iceland, if you do have COVID-19 symptoms, you get tested. If you're tested positive for COVID-19, in most cases, you'll get a phone call from a medical doctor confirming the diagnosis and letting you know about the first next steps. As part of that phone call, you will be offered to join the remote support program. And if you accept, the doctor will just tick a box on the computer, and then thereby the patient will get an automated text message to their phone with a smart link. And if you tap that link, you automatically download the app and you join into the program, where you are welcomed by a video from the clinician, in this case, the chief clinician for the care team.
Komið sæl, ég heiti Ragnar Freyr og yfirlæknir.
So you get a video from your physician, you get a video from a physiotherapist, as I said, teaching you about breathing exercises.
Ég ætla að sýna ykkur hvernig gott að gera þetta.
And then each day you will get a prompt to your lock screen to come in and fill out your symptom report. Once you do that, we walk you through the self-reported outcomes, just asking about the different symptoms of the disease. And as I said, this can be tailored to different populations, but basically asking about the core symptoms, both your vitals and then your status in different types of symptoms: fatigue, cough, nausea, etc. And then these results are shared into the care team portal, where the care team has an overview of the different patients ordered by seriousness stage. The care team will then see the overview of symptoms, both historical and the current ones. They have the option to chat with the patient. They can input their own journal notes, and then they either confirm the classification or they update it to another category. In this case, confirming a yellow classification, the system will suggest an automated message to be sent to the user, which can then be manually tailored if needed, or just confirmed, and then the patient receives that message that it's been gone over now by the team, and then you can reply to your professional. So that's the sequence there.
All right, very good, very comprehensive. Thank you so much for sharing that. And okay, let me check. We don't have any additional questions from the audience. So then let's move forward. And also our next company is coming from Iceland. So thank you again being up so early. I see that sun is shining, so that's at least a good sign in Iceland. So Kara Connect, Thorbjorg, please share your screen and start the presentation. Hey, Thorbjorg, can you hear us? Okay, it seems we might have some technical challenges. So let's move forward and then they take the next company, and then we will Kara Connect and then present after that. So next company would be Cleamix, and we have Panu Wilska. Panu, are you ready?
Yes, I'm ready. Hello, how are you?
Hey, good morning. Please share your screen and kick off.
Yes, I think we are a little bit ahead of schedule, right?
Yeah.
Hi, Sami.
Oh, okay. Now we have you. All right.
Okay.
Yeah, I had some,
Panu, if
some
it's okay,
problems.
No, actually, I prefer yielding to person who was supposed to be on this slot. Okay, so please go on as you planned. Or
yes. Okay. Thank you. All right. So Thorbjorg, yeah, please share your screen and you can start your presentation.
Yes. Hello, everyone. My name is Helka. Nice to see you all, and thank you for taking the time to listen to our presentations. I hope you're all safe and doing well. I am presenting our platform Kara, which is a software as a service for different kinds of professionals working in mental and behavioral health. Kara is from Iceland, and I am actually now in Copenhagen introducing Kara in larger markets. It's easy to onboard, so it can actually be used anywhere. But this is a story a little bit about what happened. So my background is psychology and cognitive psychology, and I was watching the children in the schools having all these problems, and I was following the money because Iceland and the Scandinavian countries put a lot of money to help kids and everyone actually. So I was looking at where the money ended. So I was actually a politician at this time. I was working in a ministry and then later as a politician myself in a municipality. And I saw the government was all very adamant in giving money out for these problems. But the officials and administrations had problems giving it to the schools, and the schools and the units and the staff and the professionals had actually no access points for helping these kids with the different kinds of professionals they needed. So let's say an autistic boy, he was supposed to get a lot of help. He was supposed to get a speech therapist, a mental professional, and all kinds of occupational health. But all these schools had really a bad option of getting them to help, or the parents were supposed to drive them around. Also, I, as a politician, could never see if this happened or not. So I had no data. So we were just always seeing increases towards mental health, a lot of money going to mental health, but we never saw if actually anything was realized. So this was what prompted us to look at this problem in a bigger way. So as you know, many of you are working for government. We have a growing problem in this sector. We have 25% of those that have problems seeking help, 75% are not. We have treatment delays and treatment gaps. We have unclear access points, and the data is missing, just like I said before. And if we look at the whole trajectory of help, the pathways, you can see that professionals have a lot of problems themselves. They are overworked, but they are underbooked because of cancellations. They have a lot of up to 1 day a week administration work. They have a lot of security issues, and they have a limited reach. So if they're a professional of a specific sort, they are just location-wise limited. And then again, they have no data on their results. And then we have the client in the middle. The client does not know where to go. Not even the schools or the units that are supposed to help do not know where to go. They are stigmatized. A lot of these 75% of the people, they are stigmatized because they don't want to tell anyone about their problem. They have to spend a lot of time with these therapists. They at least meet them 10 times on average for 40 to 50 minutes each. So that's going to take some quite a bit of time. They have a hard time matchmaking. The therapy results are actually defined by the right kind of person. Personal traits are important. And then we have no results data again. So Kara is building around this workflow. So the first thing is that security is in every step. You enter the Kara platform, both sides, clinics and professionals, very secure. We have encryption everywhere. We have an open API to connect to other systems. We have business data collection, therapy data collection to feed back to the professionals of different sorts, how they're doing. We have team and administration portals and chats and payments and bookings, all the administrative tasks that these specific types of professionals need to use. They are different from doctors, but doctors need to meet you for 5 minutes, for 10 minutes, but these need to meet their clients often. So we have a support desk for the clients in pros. So we are there to answer both the pros and the clients, because these are customized solutions for these clients and the pros. So we are there to help them with any technical things. So we connect and we log and we optimize. And these are our clients, both in Denmark and Iceland, and even Luxembourg now and Belgium. So we've had big psychology clinics and charities and health centers, municipalities. The Directorate of Labor is coming now because of all the lack of jobs in Iceland. The Ministry of Education is connecting all the school psychologists of all the gymnasiums in the Icelandic school system, the youth mental ward, helping all the kids that are having very bad mental episodes, speech therapy clinics. Ministry of Welfare is coming for the child, is working with us on child protection services, connecting the child protection services so the children do not fall behind if they're in different parts of the country. We have occupational therapists and actually all kinds of therapists, university student counseling, like I said before, and vocational rehabilitation if you have to stop working and you're trying to get back into the job market. So charities, for example, are connecting to those at home experiencing stress. So we have been helping a lot in the COVID-19, of course. The welfare unit of a couple of big municipalities signed on to connect the welfare teams together to talk to the people at home. And then we have the youth mental ward, where the young kids were supposed to come into the ward, but couldn't see the therapist. And this is our kind of favorite part of the projects, connecting to the kids via the Kara app, which is really easy for them to set up. So it's set up in many minutes.
Thank you, Ria. Okay, so you were reaching the end. Let's see if we have any questions at this point, and if not, then you can wrap up.
Yes,
and
no
complete
problem.
the presentation. Okay, so I'm going to hand over again the microphone to the audience. So let's see if we have any questions regarding the Kara Connect solutions.
Mm-hmm.
And while we are waiting, I'm going to ask a question which seems to be my standard now. So what are your plans then regarding the Singapore or Southeast Asia markets?
Well, the general plans is offering Kara as an easy solution that you can log on and use. So it's a global idea to be able to set up people in minutes, to set up their team and be able to access people that are in need. So it's the only thing we need is to standardize the languages, and that's very, very easy to do. I know that Singapore has a growing mental health problem, so we are focusing on supporting these professionals every day.
Very good, thank you. All right, and if no other questions from the audience, then let's move forward. And next company would be then Cleamix, and we have a Panu Wilska. Please, Panu, you can start by sharing your screen.
Yes, good morning or good afternoon. Let me try to get the right screen here. Okay, can you see the screen?
Yes.
All right. All right, so good morning. My name is Panu Wilska. I'm CEO of Cleamix. And what we have is a totally new method of generating hydrogen peroxide vapor for the purposes of decontamination. Now, this is normally something which is used for treating hospital rooms, laboratories, and so forth. But now during the COVID-19, we have been increasingly participating also recycling of normally disposable material. Now the history of company goes to government requirements of getting high quantities of hydrogen peroxide vapor from a small portable system. And what was the result of our R&D was a device which weighed the fraction of anything in the market while being 4 to 25 times more efficient. So why hydrogen peroxide is being used as a vapor for decontamination is, first of all, as a vapor, it doesn't harm any surfaces and it doesn't leave any toxic residuals. So hydrogen peroxide vapor disintegrates into water and oxygen. So this is absolutely safe method for decontamination, and it affects on all known germs, bacteria, microbes, viruses, even certain chemical agents. So this is what a device looks like. So it can be used as a standalone, it can network, and also it can be integrated with biosafety chambers and certain decontamination systems. So here is a good comparison. One of the market leaders compared to us, and this little briefcase has 4 times the output compared to competition in this example. Okay, so going to the COVID-19, sorry, I'm trying to speed up in order to meet the time frame. What we have been doing increasingly is decontamination of medical gear that is normally disposable. And we're talking about like N95 masks, medical aprons, surgical jackets, and so forth. So there's been a global shortage on everything. And reuse has been considered by several government authorities for a long time, but now it had to be put in action. There has been many studies earlier on, and the problem has been that the recycling with heat damages plastics, it damages essential parts. So for example, surgical knives, you can't put them in an autoclave because the heat will melt the plastic parts. Now, use of hydrogen peroxide vapor is actually something that can be done in room temperature. So these are some of the examples of ad hoc solutions being used. A decontamination chamber can be built out of a normal standard container, or it can be created as an ad hoc system. This is an example from our army. And this is the recycling pilot by the Finnish military. So they are using an old freezer container, and they actually treat 70,000 N95 masks and comparables each day. So it's a very fine-tuned process. In this pilot, you can see it takes a lot of surface area, but as I said, it's a pilot, and the production versions are taking much less floor space. So items are placed loosely in baskets and put in the treatment, and the total treatment time and processing time is less than 1 hour per each run. So how it works? So you have what we can call dirty side and clean side, and in the middle is the decontamination chamber where the gas treatment is being applied. And then, of course, you have all sort of machinery rooms and support areas. And this is the next stage, the jacket recycling, surgical gowns and jackets. This is actually being set up in one of the major hospitals in Finland now. And after pre-processing, there are 2 parallel lines and 2 parallel post-processing lines for repacking and dealing with the logistics. And this method has been validated by multiple government institutions, and this is not the only project we are with. So we have this PPE recycling programs going on in Indonesia with a major industrial player in Central Europe, and there's an active system in production in Sweden as well, and many more to come. So as said, this is just one application among many where hydrogen peroxide vapor can be used, and the test results for the Finnish Army tests are available, and it's all downloadable at their website. Here is the link. And as said, it has been proven that as vapor, hydrogen peroxide does not damage any of the materials, and it leaves no residuals. So it's totally safe for effectively making sure that there is sufficient supply of medical gear available at all times. Okay, so I guess I hit my 5-minute mark.
Yes, very good. Very good. Thank you, Panu. So we have immediately a couple of questions on on the chat box. So are the masks tested for mask fitting after decontamination?
Yes, there are multiple studies made on that, and if you click the link to the military test, they have actually published all the charts and material test results, and it's been proven that it doesn't affect anything, not even the rubber bands, after something like 20 treatments. And normally a mask is recycled only a few times because they don't recycle a mask if it's visibly dirty. It's only recycled if it can be visibly estimated to be clean. So the users who reuse the masks don't need to worry about that.
Okay, very good. And then we have one question regarding the delivery capability. So how big numbers of units and how quickly you would be able to deliver?
Practically, we can ramp up our production very quickly. It's more or less for setting up these decontamination centers. It's more about the local logistics facilities. We have a partner, Intlog, in Finland, who is making these folding containers, and another partner, IC2 Phoenix, which is part of Europinsa Corporation of Spain. They make inflatable tents, so, and the military is using both. I think it's more a question of logistical capacity of setting these up. So our manufacturing capacity is maybe dozen units a week or more than that. Everything that we manufacture are already going to the market. So the coronavirus has definitely boosted our business, but of course we would have liked that the boost would have come under normal circumstances. But anyway, it's not a capacity question. We can ramp up both of our side, and our partners can ramp up very quickly. Okay. For example, one of the latest applications that we are participating is decontamination of the interiors of aircraft. Aircraft is full of sensitive electronics and surface materials, and hydrogen peroxide vapor has been certified for the purpose.
Okay, very good. And all these links with the presentations will be shared with all the participants later on. There was another question here. Someone's asking about the slide, just the fact and advising about the costs.
About the cost? Okay, so we sell our technology only to partners because this requires very specific technical training, so we don't sell this to end users. But a typical decontamination system, I mean the full system, for example, the one that they have in Stockholm at the Central Hospital there, the total cost of the system was in range of 150,000 euros, and it was a dual chamber system. And I'm talking about bells and whistles, not just our technology, but also the supporting structures.
Okay, good. And there was another question regarding how much footprint is required. So what is the surface area?
Okay, so you saw the aerial picture of the military pilot setup, so that was exceptionally big. But if we think about a practical application, I would say that if you have 6 units of 20-foot containers, that's how much you need for a optimized and compressed system. And then, of course, some space around them in order for the vehicles to be able to approach and leave. But the smallest one that we have delivered is a single 20-foot container that is just optimized for the process around it.
Okay, very good. Great, thank you, Panu. Then we will move to our next company. BrainLit is coming from Sweden, and I see that we have Niclas Olsson, the CEO, ready. So please, Niclas, you can start your presentation. Thanks again, Panu.
Thank you. I almost said good morning to Singapore, but it's not really good morning in Singapore, so good day. Pleasure to do a presentation of us and our technology today, and I will try to wrap it up as soon as possible. BrainLit, we are a company based out of Lund in Sweden. I would say the #1 university city out of Sweden, and we are addressing a problem in regards to the circadian rhythm. and how we are optimizing our well-being and physical performance using what we call biocentric light. There are three aspects of light: the visual, to see and to be seen; the emotional, how we are affected by light in various situations and modes; and the one we specifically address called the biological part of light that affects our alertness, our cognitive performance, our immune defense system, how we sleep, how we perform in general. Our technology is based on two Nobel Prizes, the one in 2014 in regards to how to create white light with blue LEDs, and the one in 2017 how to harmonize and synchronize our cell clocks using light. When we realized where the world was heading a few months ago, it's quite obvious that what is a system that can produce ultra healthy light can also produce in reversed way ultra unhealthy light, so to speak. And we have a patent since 2017 on how in a unique way produce and distribute and control unhealthy light, in this case UVC light. And I want to spend a little bit of talking about that. But first, coming back to the healthy light. We have in our installations around the world seen some unmatched effects in terms of how we affect the people exposed to healthy light. And the easiest marker for this is actually to measure how well we sleep. That is by far the easiest way to see if we are affected or not. Our system generates biological effects within 4 minutes. We can start measuring the melatonin and the cortisol level after 4 to 10 minutes, and most people react within that time space. Within 20 minutes, we have 100% coverage of people exposed. We are running a lot of scientific studies around the world, predominantly in Europe, in this technology. The system is built upon a number of very well-defined parts. It's an advanced control system, it's user interfaces, and then we have a number of luminaires that generates this light. We have everything from elderly care homes to neonatal clinics to advanced offices to places for public where we are working with our technology to boost health and well-being. The same system, as mentioned before, can be used to produce a very tailor-made UVC light that is non-disruptive to ongoing operation. And this is normally today the biggest challenge. How do you reach a D90 level in public spaces, in hotels, in subway cars, in hospital reception areas, in industries, in schools, etc. And that's where we have a unique solution that is now generating a lot of interest all over the world. Because we can actually run our system while we have people within the operation and reach unmatched levels when it comes to decontamination of active virus and bacteria. We don't have to seal off a premises. We can do it while people are there thanks to our very advanced system. We are working with short-range radar solutions. We are working with motion detectors, etc., to ensure that nobody is within the specific space where the UVC is emitted. And the unique thing with our approach is that we can run both the healthy light and the decontamination with the same technology, with the same infrastructure. We have today users, as mentioned before, all over the world. We can see effects from our technology. And here we think it's important to talk about the post-corona world, where people really need in general to boost their immune defense system, to have a higher level of well-being. We can in healthcare settings see amazing effects on the rapid development of how people recover post-surgery, etc., etc. And we have plenty of data on this. Benefit for owners, for hospitals, healthcare systems, etc. Lower cost to install than other systems, lower cost to maintain, increased user flexibility, I would say. Give you some example of users. We have some of the largest banks around Northern Europe. Sony Corporation is a big user of our technology. We have our first installation in Singapore now coming up to be finalized at Capitaland's Future Development Laboratory. Should be done as soon as that office is allowed to be opened up again. And that is pretty much what I intended to present during this 5 minutes introduction to our technology.
Very good. Thank you so much, Niclas, for sharing the BrainLit solutions. Let's see if we have any questions from the audience. Again, the audience can ask the questions directly by unmuting yourself, or then you can post the question with the chat box and we will pick it up from there. And we have a few newcomers. So for those as well, please remember that all the presentations and the contact details of the companies will be shared with all the participants after the event. Niclas, while we are waiting the questions from the audience, you want to elaborate a little bit on your Singapore plans at the moment? You mentioned that you have a project about to kick off with the Capitaland once the Singapore will open. Anything else to highlight on?
Well, we are a scientific company based out of the university here in Lund, and everything we do originates out of the science generated at the university. And when we are entering a new market, we do that in deep partnership with potential advanced users. And I was in Singapore in the end of last year, and I had the pleasure of meeting quite a few of the representatives of the various Singaporean healthcare systems. And we are in conversation with some of them to see potential pilot areas, etc. At the same time, we are now working with I would say, some of the most leading clinics in North America and in Europe to add new features, new functions, etc. And we're almost open for new conversations.
Very good. And we have one question from the audience here. So have you had any studies on the use of your technology within the hospital environment?
Yeah, yes, we have. Okay. Quite a few, actually.
All right. Perhaps we can include some links or some of these access to these in with the other materials what we're going to share with the audience. So,
of course.
Yeah. Very good. All right. Okay. Thank you very much, Niclas.
Have a good day, all.
Thank you. And next we have VAR Healthcare, and we have Ann-Christine. Do we have Ann-Christine? Hello, do we have Ann-Christine on the line? I think that I saw her. Yes.
Hey.
Hey, okay, morning? Yes.
Good morning.
Good morning, good afternoon.
Good afternoon, yeah.
Very good. So without any further ado, we'll hand over to you so you can start by sharing your screen, and then you have 5 minutes for the presentation, and then we have 5 minutes for the Q&A. So please.
Just a minute, let's see, share screen. Do you see my screen?
Yes.
Great. So my name is Ann-Christine Rotgaard. I'm the manager of VAR Healthcare, an evidence-based nursing and decision support tool, which I'm going to present for you. So our targets is education, hospitals, home healthcare, and health institutions. Our customers, they are in Norway and Denmark. where we have the main part of the municipalities, the hospitals and universities for nursing education bachelor studies mostly. We also have the first steps into the German and Swiss healthcare market and were established last year. And now we're looking to a further expansion with our English version of VAR Healthcare. And Singapore is, of course, the number one now at the moment. The challenges that we met in the future, we've been on the market in Norway for 20 years. At that time being, we had a lot of challenges in clinical practice. So the nurses could ask themselves questions: how can I perform reliable healthcare, patient care? How can we be consistent across units? Documentation is time consuming. How can I do this more efficient and properly? And also you could be in situations where you said, well, it's been a long while since I performed this procedure. How do I do it? And how can I keep up to date? So the consequences for this lack in practice was there was a risk of incorrect treatment and poor patient outcomes. Ineffective use of time and resources. We found that it could be up to 50 variations of the very same procedure, and that does not lead to good patient outcomes. Uncertainty and lack of trust and decreased patient safety could be the consequences of that. Also, inability to systematically implement research and practice was a challenge. With VAR Healthcare, we can implement new research into practice within short time. So the solution at that time was to build a technology that best could support clinical practice in making rapid, qualified decisions for better documentation and better patient outcomes based on evidence and updated knowledge. I know that I don't think that this film will work, so we can take it at the end, but we have made a film that is on our webpage, so it's free and available for you to look at. But VAR Healthcare is a very user-friendly, has a responsive design, so you can use it on all type of devices. It's all ready to be used, so I can switch it on for everybody today. It's accessed via internet, and it's free for private use as well. So what's the return of investment? We have one hospital and one municipality, one in Norway and one in Denmark, who tries to guide this out. Aarhus is a big hospital in the Oslo area, started up in 2006, and at that time they saved 4 million Norwegian crowns. That's about 66,000 Singapore dollars. They could also document improved quality of care, improved patient flow, and the nurses could spend time on other tasks. Aarhus municipality, they started up in Denmark in 2013, and they documented the first year to save 500,000 Danish crowns. That's about 11,000 SEK. And they saved 1 million crown the following years. So the system has shown to increase communication between the staff across borders, across settings, continuity of care, less turnover because nurses now have a tool that they really can rely on and use, and that brings them together, quality of care and patient safety. So in a sense, we are the bridge between research and practice, and also between education and practice. And from the perspective of patient safety, it's essential that nurses and physicians have the necessary knowledge, competence, and tool to function in a professional, responsible manner. And we actually have experienced through the days with Corona and COVID-19 that now they really realize the importance of having one system that is updated based on the newest research and best evidence to perform safe care in these times, not only in general, but also through these times. So this is what I have. If you go into our webpage, it's sent to you an email. You also can have our video in 2 minutes. We tested it out and it didn't work with Zoom. Do you have any questions for us?
Yes, so thank you, Ann-Kristin. And we will share also the video, then it will be included for the information package, what we will share with all.
That's great, that's great, yeah.
So everybody will have that. Very good. So, and then again, handing over the microphone to the audience. And while waiting questions, okay, we have one immediately. Who are the main contributors for your library of 400 evidence-based and updated brochures? How often are these materials updated?
Yeah, this material is updated more or less continuously. I have a staff of 12 nurses with at least master's degree in nursing science. We are 3 with PhDs in my group. In addition to that, that is kind of the editor of the tool, working with this every day. I also have a research librarian who continuously look up the latest research, build up alarm systems, and so on. In addition to that, we have like 40 experts working in the clinical field, so they are also practical as well as theoretically well educated. They also have at least a master's degree in nursing. They are responsible for the various categories and content areas within our tool. And we have a system where they also they get alerts from our librarian and send us a critical review documented of what type of research should be included in our tool. Also, we are in tight connection with our users. So we have super users in every hospital, municipality, and school. They collect questions, input, and send it to us. So we build new procedures continuously based on the feedback. And also, they bring in the practical as well as experience-based knowledge, which also is included in our system. So in a way, we build up the evidence base on a higher level. So it's not longer that one nurse have a long experience and we listen to her. This is kind of a collective experience base as well as research. Was that a response to your question?
I believe so. Yeah. I hope so.
Yeah. Yeah.
There was one additional question here, that how are you different compared to Joanna Briggs?
Oh, well, this is actually a practical tool. So what we do, we use the evidence from Cochrane, from Joanna Briggs, from various databases. So we use a lot of database as a foundation. But what we actually do is we write the research summaries ourselves based on the input, based on the research, and we make it practical available. So this is a tool for nurses in clinical practice, so they can also follow and use the research without being able to or critically review the research themselves. So we have actually a decision support tool in your hand, in clinical practice, in education, which is always updated. So you don't need to do that work yourself. We do it for you. Do the critical research and the summaries.
Good.
Yeah.
Then the next question from the audience is like, have you worked with and assisted any hospitals during the COVID-19 pandemic and crisis?
Yes, we have. Not physically, but VAR has been available for new hospitals in Germany and Switzerland, and also in Norway and Denmark. So the ones who have not yet accessed have actually accessed it now through the COVID-19, because they suddenly realize it's too much work to do this on their own. And they had some hospitals who was not a customer before. They understood that it was no point making the procedures on their own or trying to update them, because everything was updated in our system. So we have actually had new customers and users through these years. Also, what we did was we turned around because we have a lot of procedures, but they wanted one procedure who could cover the whole process. So we actually made that for them with wearing gowns, how to put on the mask, how to put on the shield, how to put on the gown, and so on in the right sequence.
Okay.
So we built that within a short time, and it was available. So that was on request from clinical practice.
Okay, very good.
Yeah.
And the last question, very briefly. So what are your future plans in Singapore, and what kind of connections, partnerships, collaboration you're looking for to expand materials?
We are an independent organization, so what we actually need is collaboration due to, first and foremost, do they want to use this in clinical practice in Singapore? Do they want to use it in education? And then we would like to have a pilot hospital and maybe a pilot education to start up and to see, because what we also do is we base our content on international research, but then again, we adapt it to the country we go into. So we need more input to, are there any national guidelines that we should include? Are there any national literature, books and so on that should be included, and discuss what kind of procedure do the nurses in Singapore follow? Is it the same as we have in our system? Are there any others and so on? So we need a team or key persons to discuss with, professionals that we could discuss these things with, and being the bridge between the Scandinavian countries and Singapore. And if everything goes well, we also would like to open an office in Singapore, and then we need staff there.
Very good.
Local staff, yeah.
Great. Okay, thank you very much, Ann-Christine. We're gonna move forward and keep the stage to our last company, coming from Norway.
Thank you so much.
Thank you. Anzyz, and we have a Svein Olaf Olsson, the CEO and founder, presenting Anzyz. So, Svein, please.
Sorry. Can you see my screen?
Yes, yes, and we can hear you.
And you can hear me too. Very good. Yes, my name is Svein Olaf Olsson. I'm from Norway. Yeah, let's start. This, what I'm going to present, it is a revolution in AI, because we are able to read all kind of text very quickly, and this is the problem we solve. We can read electronic patient journals, and we can do that in less than 2 seconds with an accuracy of 92.6%, while a doctor, he use 4 hours and have an accuracy of 77%. So there is a huge difference in effectiveness and also in quality. We are not a decision system. We are a decision support system. So down the road and in the end, it is the doctor who use the conclusion in our recommendations, and it is the doctor who makes the decision. This is an article from New York Times, and this is the way artificial is handled today. It's a lot of people sitting there tagging words, and before they have ended the day, new words have occurred, and it takes a lot of time. And this is not futuristic at all. This is the way we are doing it. We have a self-learning system. We understand all kind of languages, alphabets, all kind of typos, new words, dialects, etc. And the most important thing, it is that we are able to play with multiple systems. How do we do this? We working very fast. So we received the data, for instance, from a hospital. It might be 500,000 patient records. And why do we need these patient records? We need them to create the AI base, which you can see here in the red mark or in the red circle. Then we put on our self-learning algorithm, and out of this, we create the artificial intelligence. So by doing some 3, 4, 5, 6 hours pre-processing, upload this into a computer, putting on our self-learning algorithm, we create 1.8 million combinations to understand the concept, for instance, which is here on the right side, allergy. But we can understand cardiology, we can understand cancer, we can understand all kinds of verticals in the health domain. And we are also able to predict if a patient is suicide or not. As we are able to understand natural language, we have, together with Microsoft, developed a self-diagnostic system which is incorporated with their chatbot solution. And what can we do? The patient, for instance, if you are talking about pandemic or others, the patient could, in his her phone, could write up to 15 sentences or in the computer, send this to our AI. Then the AI will read all the symptoms and understand all the kind of symptoms being explained by the person, and return with a message saying that you are either safe, you can end up as a yellow, which means that you might have you don't have corona. And if it is red, if you have all the different evidence, you should contact the doctor, because then you are getting a red flag. This is a very simple systematic figure showing this system. Here you can see the system, you write the descriptions of the symptoms, this go to the engine. Then we are using some machine learning models, and you return with the probability of coronavirus and a proposal for the patient or the person, what to do or what could be the next step. This is a system which is also developed in GPs or for doctors in general, where they can sit, they write what they see and what the patient's saying, and then these 15-20 sentences are sent to the AI, and then the doctor receive a diagnose or a proposal for a diagnose, and then he has to make a conclusion by himself. So in general, we can read patients' records, we can understand what patients are telling by writing, and we can return with a conclusion, and then the doctor is the one making a conclusion, or the patient can be advised to get in contact with the doctor, or do not need to get in contact with the doctor. So our system is used in many verticals, and it is in daily use in several hospitals in Norway. Thank you.
Very good. Thank you so much, Svein, for presenting Anzyz. And let's hand over now the microphone to the audience. Let's see if you have any questions. You can either post those questions on the chat, or you can just ask them by unmuting yourself. And while we are waiting the questions from the audience, Svein, I know we have met in Singapore, and but would you like to elaborate a little bit more? What are your plans regarding the Singapore, Southeast Asian markets at the moment?
Yeah, our plan, it is, I've already visited Singapore. We had made a marketing strategy there, and we will, as soon as everything is back to normal, we will visit Singapore, of course, and we will launch our system together, probably with Microsoft. This is something we are working on at the moment. So we are very close to Microsoft, as our technology is very unique. And we would appreciate to meet some hospitals while we are there.
Very good. And do we have any other questions coming from the audience? Okay, and we have one here. I understand that you're quite busy these days. Could you elaborate more how you have worked with hospitals during these COVID-19 crisis?
Together with the hospitals, we have had a pilot where we have tried to see if it is possible to use the system. COVID-19 is new, more or less, even if we have had viruses earlier, but at least a shutdown, as we have seen, has never been done earlier. So the system has been used as pilot, and up to now it has been well functioning. But it has not been taken in use because it is too good to be true that people can make a self-diagnostic, can get a self-diagnostic system more or less on the fly and while you are walking in the street.
Okay. Good. All right. If no other questions from the audience, and again, Anzyz also had a great video which it showcases and explains very well the product. So that will be included for the information package, what we will share with all the participants after the event. But I would call that as a wrap up. So big thank you for all the participants in Singapore. Big thank you for all the Nordic participants waking up very, very early to meet Singaporean public healthcare stakeholders during the lunch hours. So really, really appreciate that. And like I said, all the information will be shared with all the participants later on, then including then the whole video recording of this event. Thank you again. Have a great Friday and long weekend ahead here in Singapore.